The Chenet group members consist of Trinell Adams Prokop, Afisha Clark, Maureen Kotoy, Brenton David, and Elisa Dibbick. For the teaching today, we, the members of Group Chenet, chose to do multiple sclerosis, also known as MS. This is an immune-mediated inflammatory demyelinating disease that affects the central nervous system. The clinical course of MS can be characterized as a progressive disease, relapsing remitting disease, or a combination of the two. The most frequent cause of permanent disability in young adults, aside from traumatic brain injury, is MS, which affects about 2 million people globally. This has a significant socioeconomic impact on society. Multiple sclerosis has the potential to impair the brain and spinal cord, the central nervous system. In MS, the immune system attacks myelin, the protective sheet that surrounds nerve fibers, which imparts brain-to-body communication. The disease may eventually cause permanent nerve damage or nerve deterioration.
Multiple sclerosis does not have a known cause. A body's immune system attacking its own tissues is regarded as an autoimmune disease. The fatty substance that covers and shields the nerve fibers in the brain and spinal cord in multiple sclerosis is destroyed by this immune system error, myelin. Why some people develop multiple sclerosis and others is not clear. It appears that a combination of heredity and environmental variables is to blame. These elements listed can make you more likely to get multiple sclerosis. Age. It can strike at any age, however, the average onset age is between 20 and 40. However, both young and old might be impacted. Sex. Relapsing remitted multiple sclerosis affects more than 2 to 3 times as many women as it does males. Family background. You have an increased risk of getting multiple sclerosis if one of your parents or siblings has the condition. Specific infections. Many viruses, including Epstein-Barr, the virus that causes infectious mononucleosis, have been connected to multiple sclerosis. Climate. In nations with temperature climates, such as Canada, the northern United States, is far more prevalent, for example. Vitamin D. Low vitamin D levels and little sun exposure are linked to an increased risk of multiple sclerosis. Certain autoimmune conditions, including thyroid disease, type 1 diabetes, or inflammatory bowel diseases, for example, our risk of having multiple sclerosis is somewhat increased. Finally, smoking. Smokers are more likely than non-smokers to acquire a second event that confirms relapsing remitting multiple sclerosis after experiencing the first event of symptoms that may signify multiple sclerosis.
Each individual that has multiple sclerosis may experience different symptoms as it depends on the location of the affected nerve fibers. Symptoms that are associated with movements may include numbness or weakness in limbs on one side of the body or legs and trunk of body, electric shock sensations with neck movements, tremors, lack of coordination, unsteady gait, and walking difficulties. Symptoms related to vision can include optic neuritis, which occurs when inflammation damages the optic nerve, which leads to pain with eye movements and temporary vision loss, diplopia, which is prolonged double vision, blurry vision, and nystagmus, which is an involuntary, rhythmic, side to side, up and down, or circular motion of the eyes. Other common symptoms of multiple sclerosis include slurred speech, dysphagia, which is difficulty swallowing but can also include coughing or choking while eating or drinking, bringing food back up, sensation that food is stuck in throat, and persistent drooling. Dizziness, tingling pain or burning sensation of body parts, sexual problems, bowel issues, either constipation or diarrhea, bladder issues, either frequent urination or incontinence, cognitive impairment, fatigue, depression, and unstable moods.
Pharmacological intervention is the administration of medication to prevent or treat diseases or illnesses. An individual can treat multiple sclerosis by using oral medications, injectable medications, and infused treatments. Interferon beta medications are one of the most common injectable medications that treat multiple sclerosis. This is injected under the skin to decrease the severity of relapses and its frequencies. Saponimod is known as the oral medication that is taken once daily to slow the progression of multiple sclerosis and reduce its relapse rate. Alemtuzumab, the infused medication, reduces the relapses of the disease and depletes white blood cells.
Intrathecal Blacofen pump. This is a surgical intervention that's used to treat patients with MS. This pump is firstly implanted under the skin. A long thin tube delivers the medication from the pump directly into the cerebrospinal fluid surrounding the spinal cord. This method of Blacofen administration is considered to be more effective for patients with MS because of how the consistent doses are delivered close to the site of injury with fewer side effects. Before the procedure begins, usually the patients undergo a trial. Firstly, a spinal tap in which a small amount of Blacofen is injected into the spinal fluid. If the results of this trial prove beneficial, if the patient is referred to a neurosurgeon who implants the IBPS. This pump generally holds enough medication lasting several months and is usually refilled every office visit. Some of the side effects include dizziness, drowsiness, and headaches. Deep brain stimulation. This is another surgical intervention that is used in the process of treating MS. A deep brain stimulator is a device that is implanted by a neurosurgeon into the patient's chest. During this procedure, the surgeon places an electrolyte in the thalamus. The electrolytes are electrodes are connected to a pacemaker-like device by wires. This device connects the electrodes placed near the thalamus within the brain and transmits electrical impulses to disrupt the brain's abnormal signaling, which causes involuntary movements like tremors. Usually, the patient has the opportunity to control the strength of the shocks of the device by adjusting it externally. Some of the side effects include temporary pain, swelling at the site, and headaches.
For alternative medicinal treatments, if you have MS, you can manage your condition using a range of medical procedures, including prescription medication. However, a lot of people look for alternative therapies like massage, acupuncture, yoga, rest, and herbal remedies in order to feel better. These treatments won't be able to cure your illness, but there is evidence that some of them, when used in place of traditional medicines, can be beneficial. Exercise. Yoga and Tai Chi, for example, can help you relax, gain more energy, and improve your balance and flexibility. Food. It is essential for an MS patient to eat the right amounts of nutritious foods in the right amounts. Acupuncture. Acupuncture can involve placing needles at specific points on the body. It is said to have relieved symptoms like pain, muscle spasms, and problems with bladder control. Medical marijuana. Muscle spasms and other symptoms are allegedly reduced by smoking or ingesting, according to some MS patients. Pulse electromagnetic field therapy, also known as PEMS. A recent study found that magnetic fields that pulse through the body can ease the pins and needle sensation related to MS, using mind-body therapies. This could entail physically demanding medication practices like yoga or tai chi that calm the mind while energizing the body. Others like biofeedback, hypnosis, relaxation, and imagery put more of an emphasis on slowing or deflecting racing thoughts. Some people seem to benefit from these therapies for MS-related fatigue, depression, and incontinence. Cooling therapy. Heat can be excruciating. The effects of multiple sclerosis-related myelin sheath damage and thinning. As a result, when you're hot, nerve signals might not travel as quickly, which could have MS symptoms like fatigue, weakening muscles, and vision problems. Reflexology. Here, a trained professional known as a reflexologist lightly presses the soles of your feet or, on occasion, the palms of your hand. The idea of this therapy is that you are connecting you to various parts of your body, including your organs, by applying pressure to specific points on your feet that can relieve symptoms.
In conclusion, we have learned that multiple sclerosis is a disease that affects the brain and spinal cord, where the myelin sheaths of the nerve fibers are destroyed. Even with an unknown definite cause, we know that various factors can increase the risk of developing multiple sclerosis. Symptoms associated with MS can affect movement, vision, and body functions. The interventions used to treat multiple sclerosis include pharmacological treatment, which is the use of medications, surgical treatment, and alternative medical treatments such as acupuncture and reflexology. With knowledge about multiple sclerosis, an individual will be able to control their lives, health choices, and health behaviors to have optimum functioning of their body. This is the end of our presentation, and we thank you very much for being attentive and listening to us.